Good morning. Happy Wednesday. So excited to be back live on the gram today. I've got Dr. Drew Kidwell from Piedmont Concierge Physical Therapy joining me. So it'll be just a second or so. Here we go. Hopefully we can get this rolling. All right, usually takes like a little delay for all the buttons to be pressed. All right. But I'm so excited to interview Dr. Drew today. It should be popping on soon. Here we go. Hey, Dr. Drew.
Hey, how's it going?
Going well. How are you doing today?
Doing great.
Awesome.
How about things on your
Doing
end? I know
good.
you're in Durham as well.
Yeah, I got my scarf on because it's like chilly. So
Yeah.
But yeah, I'm so glad you're here. For folks watching this for the first time, I'm Dr. Vaughn Henry of Radiance Physical Therapy. I help active women prepare for a powerful birth and get back to crushing the sport you love after your baby's born. And today I've got Dr. Drew Kidwell. He is a physical therapist specializing in weightlifters, runners, and CrossFit athletes.
Exactly. Yeah. So I own Piedmont Concierge PT, and I'm based out of here in Bull City Community Fitness. So it's a CrossFit gym in South Durham off of Garrett Road. And so just by the nature of me being so proximal to a lot of CrossFit athletes, I see a fair amount of CrossFit athletes, but not just exclusively CrossFit. I see a lot of just people who are generally just into weightlifting, and are having various pain or issues and are just trying to get back to living their active lifestyle pain-free.
That is so awesome. That's so awesome. Yeah, I love that you have this specialty because not all physical therapists can help get athletes back to their highest potential. So it's such a great resource for Durham. And I'm curious, so knowing that PT is kind of broad, how did you find your specific specialty and get into this field?
Yeah, yeah, it's a great question. So, growing up, I played a lot of sports, just like a lot of PTs have a athletic background and played a lot of sports. And so I got injured naturally. And so I would go see some PTs, and that's when I really started to catch the vision. It's like, oh, this is a really cool profession. You get to help people for a living. So that kind of set me on the trajectory of eventually going to PT school. And then I, worked at various jobs for a few years after PT school. And then I've kind of landed where I'm at right now because of what you mentioned previously, that there is a little bit of a gap, right? I won't say just a little bit. There is a gap between, for a lot of folks, where they are when they're discharged from kind of a regular traditional PT clinic, and then, hey, I want to get back to muscle ups, or I'm trying to get back to, double unders, or I'm trying to get back to whatever it is, but they didn't do any of that in their sessions towards the end. So they're getting discharged without actually getting back to doing the activities they were having pain with before they came to PT to begin with. So I kind of saw this need for filling that gap. And so I help people kind of get where, yes, they're out of pain, but let's get you back to, whatever it is, bench press, let's get you back to deadlifting, let's get you back to muscle ups. And because, having access to a rig and having access to barbells here in the gym, we're able to do those things.
That's so awesome. Yes, I love how you can get so specific. Yeah, because I see that a lot too with the postpartum athletes. They get cleared from their pelvic PT, but they've only done exercises on their
Right.
back. But what you love requires way more capacity than that. And you really,
Exactly.
yeah,
Exactly.
to avoid injury, helping build capacity is key.
Yeah. So I'm preaching to the choir. So I knew we had a good connection because I know you speak the same language.
Absolutely. And then so kind of like shifting gears a little bit, like what's a fun fact you could tell folks about you that they may not know, knowing that you have a specialty, but like what else makes Drew special?
Yeah, I was thinking about that. So I spent some time in Nairobi, Kenya after undergrad. So when I graduated from UNC Chapel Hill, Go Heels, I went overseas for a little bit, and so did a leadership development program with some college students on local campuses there. And so I spent about a year and a half of my life there in Nairobi, Kenya. So that was home for a period of my life, and loved it, loved every minute of it. And so that's kind of a, a fun fact. I had some experience overseas, and that's definitely changed me as a person, and just gave me a broader perspective on life and people in general.
Yeah, no, I love that. Overseas travel will really just broaden your perspective. So that's really
Mm-hmm.
awesome. That's really
Yeah.
awesome. That's great. Okay, so then like flipping gears back to like exercise, PTs, what would you say is like the top problem people are reaching out to you for at Piedmont?
Yeah, so I see a lot of a fair amount of shoulder injuries, so issues, pain with snatches or overhead press, anything overhead related, so pull-ups, things of that nature. And so working specifically with patients on developing a plan of care to get them, laying down a path of getting them back to snatches with weight where they were at before, and chasing after those personal records, and trying to move more weight, but doing it in a safe environment, and doing it slowly over time, adding that weight. And so I really feel like I see a lot of shoulders, but also work with a lot of low back pain patients. So people are having issues with back squats and deadlifts, and are trying to get back to where they were before, but just need a little bit. They need some help. They need some coaching. And so that's the role I kind of fill.
That is so awesome. Yeah, as myself, I've gone through some shoulder injuries, and overhead work and CrossFit is no joke. So really
Yeah.
understanding how to like rehab and have a
Mm-hmm.
path to move forward is
Yeah.
like it's key for athletes to be able to make progress. So I
Yeah.
love that you have that specialty for that. And then like what else would be helpful for folks watching this to know about being able to find not only a PT that specializes in like helping athletes, but like knowing that like running, CrossFit, all those things, like you do it.
Yeah.
What's something that could be helpful for people to know?
Yeah. I always like to remind people, and I think, for the most part, people know about this, but I still talk to people every week that don't realize that you don't need a referral from a physician to actually see a physical therapist in North Carolina. If you're a federally paid insurance program like Medicare, of course, you would need a referral from a physician. But if you just have a non-federal based insurance, you don't need a referral from a physician to see a PT, which is fantastic. So you can come straight and see, yourself or myself, and not have to go through the hoops of getting a referral from a physician. Because I feel like a lot of times that can be, a source of friction. It just takes a long time to go see a doctor, only for them to tell you, oh yeah, you need PT. So I want to let people know and educate people, hey, you can come directly. We are a direct access state, and so you can come and see a doctor of physical therapy without a referral, and we have the necessary skills and screening ability to know if you need a referral to a specialist, right? So I've seen patients that come and see me, and they're not appropriate for PT, and so a good physical therapist that's trained well has the ability to screen patients and be able to direct them and refer them to the appropriate next step. So I just want to kind of educate and let people know that we are the movement specialists, and so we want you to come see us if you're having issues with movement related things, activities, lifting, running, whatever it is. PTs would be your first place to go, instead of having to go through the hoops of kind of our medical system, which is unfortunately can be a little bit convoluted at times.
Yeah, that's such a helpful reminder, because the system we have is, it's great for some things, but it can delay access to care. And when we're looking at like well-being and health and like trying to stay active in your sport, sometimes those hoops are like really unnecessary. So
Right.
yeah. But yeah, that's so good to know. And then you also said something that was super key about that screening, recognizing when maybe PT is the first step, and then maybe there's times where PT isn't the first step. So also recognizing that that team approach is, you know,
Mm-hmm.
no one provider can do it all,
Mm-hmm.
but being able to screen and refer out, and particularly for active adults, having a team that can help you reach your highest level is key.
Definitely,
So I
yeah.
love that.
And if I could add to that real quick, Dr. Bong, is you know, a big part of, you know, me reaching out to you, and you know, I know we have a workshop coming up that we'll talk about here in a little bit, but I want to be, I'm not a pelvic floor specialist, and so that's not something that I see on a regular basis, but I want to get as a clinician, I want to be able to screen for those things, right? So I want to be able to ask my patients who aren't necessarily coming to see me for pelvic floor related dysfunction. But you know, we're working on deadlifts, and then they just happen to mention that they're having issues with leaking. Like, I want to be able to refer them to the appropriate person that's going to give them the best help and care that they need. So
Yeah, no, yeah. Well, it's so true. Even like the pelvic floor piece, women leak even if they've never had children. Women, female athletes, so like
mm-hmm.
running, lifting.
Mm-hmm.
I've, you know, shoulder to overhead and double
Yeah,
unders. Those are the big ones. So
right.
recognizing that that team approach is really key. And just like the CrossFit training is specialized for PTs, the pelvic floor training is specialized for someone who becomes a pelvic floor PT. And then also for me being able to be like a pelvic floor therapist who helps CrossFit athletes, that's even
Mm-hmm.
a higher level of training. And it also helps that I'm like, I do CrossFit and I run. So those things are
Yeah,
enjoyable to me, and I love seeing people thrive in them. So, but yeah, that's so
right,
true. Um,
right, right.
and then, what is a common myth you could bust that you see out on like social media, like Instagram or TikTok, about PT?
Yeah, yeah. Honestly, to be completely honest, I don't spend a ton of time on social media, but yeah, like when I do, I feel like there are a lot of you know, clickbaity type stuff where it's more passive approach to rehab, and so you know, not I think there's a time and place, certainly. Like, there's things that I do as a clinician that I implement with my patients and plan of cares where it involves, you know, soft tissue massage, it involves dry needling, it involves some of these more passive modalities. But in general, I would say I take more of an active approach to rehab. So I want to make sure, again, going back to what we talked about previously, if someone is having an issue with, let's say, deadlifts, before they, you know, wrap things up with me, I want to make sure that we are deadlifting here in the clinic and actually loading the bar and getting them lifting again comfortably and confidently without fear that they're going to re-injure themselves. And so I don't want to just do manipulations, right? I don't want to just do passive modalities to patients, kind of the feel-good stuff that everybody, you know, everybody loves a good massage, right? And feels better afterwards. But making sure that we are addressing the root cause of why you're having the pain to start off with, and giving you a solid active approach. So exercises, mobility work, things that are going to be the long-term fix to make sure that this isn't a reoccurring issue in the future.
Yes, I love that. And the other key thing you said was tackling the fear piece. Because
Mm-hmm.
when you've had an injury, the risk of having another injury is very high. And when you're
Yep.
fearful about it, you change how you move,
Mm-hmm.
and that affects your performance. So that's
Mm-hmm.
really, really great that you not only help people get pain free, but also like guide them being pain free in that specific movement that they might have some fear about to help them build that confidence.
Exactly. Exactly. Yep.
Yeah. Well, as we're wrapping up, yeah, let's talk about this workshop that's coming up on May 4th.
Mm-hmm.
And so I'll be at the Bull City Community Fitness on Garrett Road, where Piedmont is related.
Mm-hmm.
And maybe what are so you mentioned like leaking with deadlift. What are
Mm-hmm.
some of the other things that you might, as a non-pelvic PT, notice
Mm-hmm.
or appreciate the challenges that the athletes have?
Yeah. So kind of in the gym space. So I'm literally housed inside of the gym. So I'll hear conversations between, you know, members and CrossFit athletes and people you know, kind of jokingly mention like, oh, let me run to the bathroom because we're doing double unders today or box jumps today, right? So it's that, you know, it's that high impact jumping off of a box, repeated jumping with double unders, that gives people issues. And it's a common thing that a lot of people deal with. But one of the things it's kind of a running joke, right, in gym spaces. And so I just want to be able to provide a workshop completely, you know, free, that people can come and just learn more about what they can do to help prevent these kind of pelvic floor issues when they're working out.
Yeah. Yeah, totally. I'm super excited about it. Yeah, so we're going to be tackling double unders, deadlifts, and how that relates to your pelvic floor. Everybody has a pelvic floor. People who identify as female are not the only people who leak too. So this workshop is for anybody. If you want to learn more about what the pelvic floor is, if you also want to like understand a little bit about your abs and the things you heard about on scrolling, because for me, like a lot of my athletes are like, oh, I saw this. Now that I'm pregnant, this is scrolling. This shows up on my, what is it, algorithm is like, you know, don't do this exercise, don't do that one.
Right.
And so there's a lot of fear. Sometimes it's unnecessary, but really just understanding like people just don't know what they're looking at. So,
Right.
but yeah,
Right.
so we'll tackle that. And so if you're a coach watching this, we'd love to have you. You can use the link in my bio. You can reach out to us, DM me, DM Drew to get more information. And yeah, so we look forward to seeing you there. Anything else you want to share before we wrap up, Drew?
No, yeah, just come out. It's May 4th. So if you're a Star Wars fan, may the 4th be with you. You can come and celebrate at a pelvic floor workshop for free. But yeah, come bring a friend, right? And this is not just for you know, athletes. It's also for coaches as well, and anybody who's working. You know, even I tell, you know, I'm a man, and so I you know, want to make sure that, you know, men are also welcome to come. And if you have a spouse that's maybe either pregnant or is postpartum, this would be a great thing for them to attend as well. And so, yeah, men have pelvic floors too. So if you're hearing this and you're a man, you're not excluded from this, as you're also welcome to attend as well.
Awesome. Yes, yes, yes. Great. Well, I could keep going on, piggyback about that, but I know we both got a clinic to get back to. So again, thank you so much for your time, Dr. Drew. Folks, catch the replay. Make sure you save it or forward it to a friend, and we will catch you on May 4th, hopefully, if you can join us. Take care.
Awesome. Thanks.
Bye.